Hey everyone, welcome to another edition of Healthcare Update. It's been an exciting week in healthcare this week. We have a lot going on. Here's a follow-up to last week's update. We talked about how the Humana and Aetna deal fell through, a huge proposed merger between a couple of the largest for-profit healthcare providers in the country. And so that fell apart last week. This week, Humana announced that they're pulling out of the individual exchange markets. Now, this was something that came up during the initial proposal about the merger. And there was background information that was being floated that Humana would back out of the exchanges unless the Obama administration approved the merger. The merger was turned down, and sure enough, they pulled out of the exchanges. So on the Cigna side, they want $13 billion in damages, even though they're getting a $2 billion breakup fee. So these mergers are interesting. Even these proposals are leaving a lot of damage and harm in its wake. Most of the action this week has been with health policy in the Trump administration. And last week, Mr. Trump signed an executive order, a fairly large executive order, and interestingly, not very transparent. It's been difficult to get your hands on this to see what's going on. But here are a few of the big issues that they're talking about with this executive order. The first thing is the guaranteed availability provisions of the Affordable Care Act. The ACA allowed a 3-month grace period if a consumer was not able to keep up with their premium payments. The insurer had to provide services for 3 months until to allow the consumer to make up and catch up with their payments. And there has been anecdotal data suggesting that there is end-of-the-year gaming, that patients stop paying their October, November, December payments, and the insurer has to provide services, and then at the end of the year, the consumer goes to another insurer on the exchanges. And so they're going to tighten up this grace period, and they're going to keep track of who has been delinquent on their payments with previous accounts. They also want to tighten up on the special enrollment periods. And now one of the provisions, because of the issues with adverse selection and moral hazard, it's very, very typical that there is an open enrollment, typically like in November, where you have to decide if you're going to have insurance for the next year or not. And because if they just left it open all the time, people would wait until they're sick and then get insurance, okay? Now, so you have to decide the previous year what your insurance is going to be for the whole year. But recognizing that life happens and sometimes people change jobs or they have a child, they have allowed special enrollment periods under the ACA provisions. And they feel like that has been abused. And so they want to tighten this up a little bit, and they want to require more verification of the life change. They want documentation. Before you get in, they want to see the paperwork. They don't want to permit people to upgrade their insurance. That if you previously were at a silver level plan and now you have a child, you have to continue at the silver level plan. You can't upgrade this baby to gold or premium level insurance, platinum. And finally, they want to limit the number of conditions that will qualify you for a special enrollment period. Finally, they want to tighten up and do more assessments of the network adequacy. One of the things we have found over the past 30 or 40 years that works to control costs is narrow networks. If you have to manage carefully the amount of specialists consumers are allowed to see. when it's a wide network and they can see a lot of different kinds of specialists, then you get into a lot of low-value providers. When it's a narrow network, then you can keep the focus on high-value providers. Aside from the big recession of 2008, this narrow network tool has been one of the most effective in controlling costs. So, but the concern is, from the federal perspective, is the network breadth adequate to serve the needs of consumers? Is it too narrow? So they want to adopt, for the exchange plans, they want to adopt a quantitative network assessment that was developed by CMS for the Medicare Advantage. So they're going to just simply extend that over. We have not seen any resolution to some big issues from the insurers' perspectives. For example, the billions of dollars in risk assessment that was provided for under the Affordable Care Act, much of that has not been paid, and the insurers are suing. Now, as you recall, the Affordable Care Act prohibits medical underwriting. So insurers had no way of knowing, as they took on customers, the amount of risk they were taking on. In the end, it would all just randomize, but during the transition for 3 years, the ACA provided for risk adjustments and risk corridors. And the idea is that if insurer A inadvertently took on too much risk, and insurer B inadvertently had less than the usual amount of risks, well, then the insurer B would transfer money over to insurer A to pay them for taking care of some of their risk. And it would all go through federal agencies. Well, the payments were inadequate. It was all supposed to be budget neutral. It wasn't. Now there are billions of dollars owed, and it's a big mess that's being litigated. And so this is a big unresolved issue from the insurer's perspective. Some of the conservative members of Congress want to just declare null and void all this risk management and have all that money go to the Treasury. And of course, to insurers, that is not acceptable. Another big issue from the insurer's perspective is the individual mandate. And without the mandate, the individual mandate pushes customers towards insurers. And from the customer's perspective, those are premium payments. Remember, from the insurer's perspective, that is revenue. So the individual mandate is important. A lot of that money then gets transferred to providers, to hospitals, to pharmaceutical companies, which comes to them as revenue. So if this individual mandate goes away, there is a domino effect that could work its way through all the healthcare system. In a tentative step, the IRS announced last week that they will accept silent returns. The law demands that consumers, when they're filing their tax return, check off, were you insured last year, yes or no? The IRS has announced that they will not enforce silent returns. In other words, if no box is checked, then they will accept that return instead of kicking it back to the consumer. So that's a tentative first step in making the individual mandate go away. And of course, last week we saw the House Republican proposal come out where they want to, instead of a law demanding that people have health insurance, they want to create a tax structure that incentivizes health insurance. Instead of having subsidies, transfers of money from the federal government to individuals, the Republican Congress is talking about instead having health savings accounts, which haven't worked before. You know, the original idea was, well, consumers could save money with tax benefits into these health savings accounts and then spend them, and that didn't work at all. Americans don't save, right? So instead of subsidies, House Republicans are talking about having these health savings accounts that are primed with tax credits or deductions, tax money. Now, it becomes a big debate whether these are tax credits, like instead of paying the IRS your taxes with your money, you take that money and go buy premiums. That sounds really attractive, but the CBO has not scored the budget impact, and it has to be budget neutral. And instead of having everybody participate to offset the high consumers of healthcare services, they want to create high-risk pools. And of course, the problem was the Affordable Care Act spent $30 billion creating a high-risk pool during the transition, and that was not nearly enough money. The total amount of money needed to cover this high-risk pool, to fill the pool enough, was $175 billion. So, okay, great. High-risk pools are great, but are you going to fund it adequately? And the amount of money needed to fund it adequately is enormous. And finally, the House Republican proposal talks about shifting Medicaid to the states with block grants. Medicaid has been administered through the states, but much of the funding and the regulations came from the feds. So they want to have states take over everything, okay? So these are outlines. It's not really a proposal. They're outlined. They're rough ideas. They're principles. And the next big step, it's currently out at the Congressional Budget Office, some of these ideas, and the CBO is going to score the budgetary and financial impact of these. So that's the next big step, and we'll stay tuned to see what happens with that. So have a great week, everybody.